The study setting is a secondary mixed school located in Sri Lanka. A random sample method was utilised where authors selected participants from 4 grade 7 classes, encompassing a total of 209 students. Various methods were utilised, including group activities, video clips, and success stories to ultimately address harmful effects of smoking. Students identified determinants influencing tobacco smoking among peers and prioritised the analysis of incorrect attitudes about smoking and tobacco company strategies as determinants. Other determinants influencing tobacco smoking were explored with the students. Outcome measures encompass firstly the improvement in knowledge, where students were educated about the harmful effects of smoking and tobacco company strategies used to promote smoking. Secondly, the proficiency in identification and analysis of tobacco company strategies, where students identified strategies and wrote them in innovative tools called media books. Thirdly, the effective dissemination of acquired knowledge, where students shared their knowledge and experience with colleagues, family, and children's societies. And lastly, changes in attitudes towards smoking, where over half of students' initial perceptions of smoking were positive, and all of the students' post-intervention perceptions of smoking were negative. The development of the health promotion intervention is justified from the key assumption that the majority of lifelong smokers begin smoking habits during school age, making this period crucial for tobacco companies to target students. This assumption is supported by identified strategies of tobacco companies, which promote smoking near schools, within schools, and through media aimed at young audiences. The second key assumption is that empowering students through education will enable them to make informed decisions and consequently control their own health. This is based on the belief that critical awareness can be fostered through education about the harmful effects of smoking and direct engagement on the determinants of smoking. It is further assumed that through targeted educational efforts, students would become advocates against smoking and that attitudes about smoking would change.
Health promotion is the process of enabling people to increase control over and to improve their health. It moves beyond a focus of individual behaviour towards a wide range of social and environmental interventions. This intervention incorporates multiple health promotion principles. This is done by following certain healthcare models. For example, the biopsychosocial model of health. This model emphasises on the psychological response to ill health and its interventions necessary to maintain and restore health. This model focuses on risk behaviours and healthy lifestyles, emphasising health education and the focus on individual responsibility. This can be related to our initiative as educating students on short-term harmful effects, sexual importance, and passive smoking helps to minimise risk factors and allows them to focus on their individual responsibilities, thus correlating with developing personal skills in a section of the Ottawa Charter. The societal model of health. This model recognises health as being the result of a complex combination of factors, including the societal influences that are outside of the individual's direct control. Within the initiative we have chosen, they discuss false expectations and behaviours around negative image. This allows the students to recognise social, cultural, environmental and economic pressures of smoking. By using multiple modes to educate the students, it contributes to the reorientating health services factor of Ottawa Charter. Thus, as well as building public healthy policies, as there is a lot of smoking-free areas and free education around smoking in schools. In regards to the biomedical model of health, this only applies vaguely, as we can say early education acts as a preventative measure. All three of these models encompass into the health promotion model of health. This initiative deemed success as it was sure that it coincided with all areas of the Ottawa Charter, as well as having their prevention take place on a population level. Socio-ecological approach model is also relevant throughout this initiative. As all information is backed with policies, they have reference to social interactions and rely on the individual's choice. Within doing so, it incorporates health education and health promotion, thus allowing the key strategies of the Ottawa Charter to be present. And finally, because this initiative is a form of active, comprehensive and organic health promotion, it will help to minimise all social determinants of health.
The aim of this intervention was to reduce the prevalence of smoking and tobacco use among high school students, which is appropriate for the selected health topic of tobacco use. Targeting students in high school is a fitting choice as it is believed that students are their most vulnerable in high school to the influence of tobacco. The methods used such as group activities and video clips were relatable for students, allowing for easier understanding and further engagement. Additionally, discussing short-term harmful effects, sexual impotence, and passive smoking in ways that capture the student's attention also make the intervention more powerful. Allowing for students to discuss their knowledge and experiences in the intervention creates a supportive and safe environment, promoting peer learning and a closer connection amongst the students. The program also discussed the key causes that lead to smoking initiation, such as false expectations, incorrect symbolic meanings associated with smoking, and the influence of tobacco company strategies. Furthermore, this ensured that students also understand how many tactics can be used to influence them to undertake tobacco use. Through the results, it is evident that the students' perception of smoking has significantly changed their behaviours and attitudes and will decrease the chance of them undertaking it. A research article on effective health promotion methods for smoking states, reaching the mass public by social marketing and mass media interventions, peer education whilst approaching the community via community mobilization and changing the environment by media advocacy and setting-based intervention seems to be an extremely effective method of inducing smoking prevention. This supports the methods used in the intervention and also allowing for more methods to be used in the future. Overall, the intervention was appropriate for promoting the selected health topic of tobacco use within the context it was being applied. Using well thought out strategies and methods as well as targeting a critical age group will create a significant reduction on tobacco usage.
The social determinants of health encompass a lot of basic as well as more complex needs surrounding individuals and groups. These range from the personal level to the broader social needs. The intervention at hand within the grade 7 students in Sri Lanka addressed a variety of their specific needs, but also having missed a key few. Firstly, a standout health promotion strategy utilised was enabling. This was evident using educational material surrounding the determinants of incorrect attitudes and company strategies. Adolescents have a strong desire to establish their identity and for self-agency, so meeting their need for education allows for increased self-empowerment in addition to life skills and values surrounding future health-related decisions. On this note, while the intervention thoroughly applied the development of personal skills, there are wider social needs which lack addressing. Having family members and or peers who smoke tobacco is a strong social determinant in young adolescents taking up tobacco use. This is where a socio-ecological or SEM approach would have been beneficial in addressing these interpersonal influences on smoking. In recognising these social networks as necessary for adolescents, a dynamic approach addressing this complex sphere of influence would be more prioritised in a SEM intervention. On the contrary, though, the current study had a broad range of educational modes addressing potential communication needs. Additionally, the setting-based component taking place within the school environment meant that the middle schoolers were not given any financial burden, thus meeting economic needs. Lastly, male students are known to be more likely to take up the detrimental health habit than females are. This highlights a greater need for tailored health promotion for boys in particular. Overall, however, the intervention actively addresses multiple areas of relevant need, but simultaneously misses a few important ones for this target audience.
While the study had many positive attributes and the before and after statistics were impressive, some minor details could have further improved the intervention. Some improvements that may have been included consist of a simple knowledge test on general smoking information, including risk factors and protective strategies could have been administered. This test could be completed prior to the intervention and then once again after to gain a broader understanding of the areas of strength of the intervention, as well as any areas that may need to go into more depth. In terms of developing this intervention based on the health promotion principles, the administrators could have included other members of the community, specifically those aged 16 to 34, as this age group has the highest prevalence of smoking, especially living in rural areas such as Sri Lanka. As many research articles, such as one by Alistair Lum in 2020, suggest that those living in rural and remote areas, as well as those in third world countries, suffer from higher rates of smoking. This correlates to the study as if they include a broader range of people in the intervention, including success stories and harmful risks, to encourage the individuals to quit or may be deterred away from trying. This approach would raise the health literacy, develop personal skills, and strengthen community action. With more people aware of the risks, the community is more inclined to assist in creative supportive environments, such as smoke-free areas or support groups.
If this intervention is implemented across a broader age range and included current smokers, the trans-theoretical model could be used alongside existing group activities, success stories, videos, and etc. This would help facilitate action, maintenance, and the termination stages for those who already smoke. An article by Maeva Golchi in 2016 assesses the effectiveness of health promotion strategies, including community mobilization, and the impact of societal change and empowerment. It shows a significant change in smoking behaviour when community works together as a unit, with 23 studies indicating at least one favourable outcome.
This study aimed to empower school students to avoid smoking by reducing the attraction to tobacco consumption through a health promotion approach. Conducted at Walashinghi Mahavidyalaya, a secondary school in Sri Lanka, the study involved 209 grade 7 students selected through simple random sampling. The intervention's success stemmed from recognizing economic concepts like access, opportunity costs, and cost-benefit analysis. The program included group activities, video clips, and success stories highlighting the short-term harmful effects of smoking, such as sexual impotence and passive smoking. Students discussed determinants influencing smoking and prioritized these factors addressing incorrect attitudes and tobacco company strategies. By improving access to information, students were equipped with knowledge about smoking's harms and deceptive industry tactics. Opportunity costs were introduced by discussing smoking's negative implications, such as health risks and financial burdens, versus the benefits of staying smoke-free. This helped students weigh factors leading to informed decisions. Data were collected via focus group discussions and analysed using qualitative and quantitative methods. Results showed significant improvements in knowledge about smoking's harms and company strategies. Post-intervention, 73% of students identified these strategies and 65% began documenting and sharing this information through media's books. Additionally, students shared their knowledge with peers, family, and community groups. The most notable change was in attitudes towards smoking. Initially, 52.4% viewed smokers as heroes, but after the intervention, all students regarded smoking as a stupid behaviour, demonstrating effective cost-benefit analysis. Strengths included incorporating economic principles, a holistic health promotion approach, and engaging interactive methods involving the broader community. However, the study's limitations include its single school setting, short-term measurement, potential self-reporting bias, and cultural context. In conclusion, the intervention effectively reduced tobacco smoking attraction among students by recognising access, opportunity costs, and cost-benefit analysis. Further research with larger diverse populations and long-term follow-up is essential to fully understand its impact on smoking behaviour.